Pursuing beauty is human nature. Although the standard of beauty varies from person to person, facial symmetry and harmony are the most acceptable requirements for beauty. Facial asymmetry and disharmony are commonly the disturbing concerns for patients. A developed system can improve the prediction of surgical outcomes as well as bridge the surgical planning strategies between physicians. Professor Jingjing Fang and Dr. Dongyao Wang from the National Chenggang University have developed such a system called the Navigational Articulator System. It utilizes an optical tracking device to track the planning movements of plaster casts, allowing for osteotomy simulation and synchronizing the movements between the physical plaster casts and the jaw bones after osteotomy on the computer. The Navigational Articulator System is a 3D computer-assisted system, which can precisely examine the symmetry, facial ratio, and occlusion status of a patient's facial structure in pre-surgery, planning, and post-surgery, thus providing a target reference for surgeons to make an optimal planning. Computer tomography imaging uses the original data resource for building up the whole system, and we have a self-developed program used for analyzing symmetry status. We have built a tracking device so that while we move the plaster teeth casts, we also collect bone symmetry information. It shows the bone image, so we can look at the symmetry status, and in a very short period of time, we can confirm the plan of bone repositioning. So it is more realistic and more accurate. Professor Fang's team has developed the Navigational Articulator System. System hardware consists of a self-developed optical tracking device, a commercial articulator, and a self-developed articulator fixation base. In relation to the software, functions include medical imaging osteotomy planning, real-time tracking plaster casts corresponded to jaw movements and its associated symmetry status, and dynamic cephalometry information. The Navigational Articulator is a useful tool which has a special design for planning orthognathic surgery. The system consists of several parts. The first is medical image reconstruction, which was fully developed in 2000. The second part is the novel symmetry analysis program. This is a unique method in the world. Basically, in terms of 3D image analysis, instead of using points for symmetry analysis, we use symmetry planes to evaluate whether the angle and distance deviate much between the maxilla and the mandible. The third part is the Navigational Articulator System. In 2006, we applied the system to the first case, and by now, we've had about 50 clinical cases. Some facial asymmetry situations are quite complicated, such as patients who need double jaw correction, or patients who have severe asymmetry, or patients who have tumors. We were very satisfied with the system using OGS planning. We, including myself and other orthodontists and cosmetic surgeons at NCKU Hospital who participated in some cases, all agree that this is a good method. The system met clinical needs and its application outcomes pleased everyone. Such a model surgery method is actually similar to traditional methods, except for the integrated 3D tracking device in it. The advantage of this method is that surgeons do not need to learn new skills, such as computer drawing or animation. Surgeons can still use their former training skills from medical school and gain more information by using the new technologies of synchronized tracking and symmetry analysis previously mentioned. The integrated planning system will be more acceptable to surgeons. The Navigational Articulator System is a medical device to be used in orthognathic surgical planning in the oral and maxillofacial departments. Its subdivisions and fields of application include dental implants, tumor removal, and cosmetic surgery. There are many potential opportunities to cross into other medical markets. minimize blind spots during surgery requires a comprehensive surgical planning and more advanced medical equipment. Professor Fang's specialty is in the area of 3D model reconstruction, pre-surgical planning and evaluation, surgical guidance, and post-surgical analysis. In terms of the communications among doctors or between doctors and patients, having an image or having a symmetric face would be an excellent communication tool. This novel medical device, the Navigational Articulator System, will become the best choice for hospitals or medical centers in elevating the success rates of orthognathic surgery and building up good reputations.